Hi everybody, happy St. Patrick's Day. We hope you've been enjoying yourself all weekend. We've had a lot going on and a lot to do. And you know, it's a holiday, a lot of people are going to be out. It would also be a great day to look great. So Great Look Monday falls in line perfectly with St. Patrick's Day, because who wouldn't want to look their best today and every day? Dr. Sam Shatkin Jr. is back from the Aesthetics Associate Center with more information about what they can do for you. So good morning, top of the morning to you.
Well, you don't need the luck of the Irish to have good skin, I can tell you that.
Well, that's right. You are absolutely right about that. And you brought some of the tools of the trade to show people how really you can go in any direction. You can go with less invasive, more invasive, some creams, and you have it all.
Well, the thing about it is this, you know, we've got so many new technologies now, and things have changed so dramatically that I think we can really improve on what the patients need. And a lot of patients come in and they just have problems, say, with breakouts and acne. They need control. On the other hand, we have a lot of patients that come in that just want to have anti-aging changes in their skin. So we offer a lot of different services, and we've got all the new technology to do that. All
right, well, start us with what you brought today, because I can tell you, I can speak from experience, and I noticed that as women are changing, it always in magazines you see in your 30s expect this, in your 40s expect this, in your 50s, etc. So women's skin and men's skin, we change every decade or so.
Well, that's true. I mean, this particular machine here is called the isozyme machine, and what it essentially does is it passes an electronic charge to force the products that we recommend into the skin, the antioxidants, vitamin C, vitamin E.
Nice.
It can increase the absorption up to 300% on a particular product, the ones that are, and it uses both sonophoresis, which is a vibratory energy, along with the electronic charge, ionophoresis, and it can dramatically improve this. And this is a product that is only sold in doctors' offices. There are some similar products in spas, perhaps, but this is a machine that we've used now. This is our second machine now. We have two of them because we know the benefits are so tremendous. And if you need that antioxidant treatment, and a lot of people do, it can be really very beneficial.
When you see a machine like this, it looks like hardcore medicine, but I think we have a picture of someone getting this.
Yeah,
this is very relaxing.
Well, it really is. Let's look at it. Here's the picture.
She's having it
this
now.
is actually one of our patients, and she's essentially got this white gauze that's impregnated with the various gels that we want to use on the skin, and then that wand, which I was showing you live just a minute ago, on the skin to enter this wand here. Really generates that energy to force the products into the skin, and the results are very, very dramatic, and the patients love it. It's very soothing.
So she's sitting back and relaxing, and that's basically all you need to do as the patient.
We've got the wave music and the stuff that's very calming and relaxing. The patients really like it, but this is really how the treatment goes. And those little black clips you see near the hairline, those are the electronic charges that help force that product and the ingredients of the product into the tissues, opens up those channels.
So, and you're putting emollients and everything on this, so this is really it can penetrate much further into the skin.
Yeah, exactly.
Yeah,
that's the whole idea.
Especially for people with extra dry skin, that would be great.
That's the whole idea, exactly. Yeah. So this is a non-surgical method to help rejuvenate the skin. Now, if we can show the next photo that we brought with us today, maybe we can demonstrate that, because this is talking about a filler that we use. Fillers can be used to soften the lines. Now, again, non-surgical. You can see this is a woman that had her folds filled in, the marionette lines as some people call it, both from the nose to the mouth and below the corners of the mouth, and it can dramatically soften it up. And this is something that is about a 10 or 15-minute procedure. It can be done, you know, on your lunch break in some cases, and back to work you go.
Wow.
And it's a very nice way to...
Is it true that women who smoke have more severe lines than others?
Well, the truth of the matter is that women and men that smoke have much more severe change to their skin, and the aging process is so much more dramatic. So I guess it would say hand in hand, but there's a lot more to it. Bad skin comes from sun exposure. Bad skin comes from heredity, which you have no control over. Bad skin comes from excessive alcohol drinking. And believe it or not, and there's been a lot of reports on the news lately, actually there was a great segment on 60 Minutes last night that talked about sleep and what sleep can do to your general health. So there's so many things that we know now, and things that my staff will help you understand to make your skin look better and healthier.
All right.
So it's not just about one thing, and nutrition as well, too.
Certainly.
As you know.
Let's go to the next case, and you can tell us about this.
Now here is using that machine that we demonstrated early on, where you can reduce that inflamed appearance of the skin, acne problems, softening the skin, evening out the skin tones, making the skin look healthier and fresher, and that's really what it's all about. This morning, for example, I had a woman that came to the office. She's a 39-year-old. And had still acne breakouts. Now, the hormones change for the women. That can create the problem. But what we do is we focus on the problem that causes the acne, the buildup of the dead skin on the surface, plugging up the pores, preventing the oils from escaping. we focus on that, and we've had very good results with the patients.
All righty, all right. I also wanted to ask you about this little machine here.
All right, well, this is great. This is something we use in addition to the things we already mentioned. This is the Clarisonic brush. You can actually, if you get in close, maybe you can see these bristles vibrating. But essentially what it is a...
Can I touch that?
Absolutely.
Ooh,
it's soft.
yeah.
You use it on your skin. It's got a 60-second cycle, so you can hit the forehead, the cheeks, the chin, and the neck, and cleanse your skin every day. It's almost like the toothbrush. In fact, the developer of the Sonicare toothbrush developed the Clarisonic skin brush.
Oh.
And it's very helpful to wick away, take the debris away from your skin, and just
great.
Dramatically help.
Did you tell me Oprah's a big fan of this?
Well, it's on Oprah's list.
It's on Oprah's list?
Yeah, and
that's because we wear heavy-duty makeup, and this would be great for those
well, it's
of
good
us
for that, but
who wear industrial makeup.
Yeah, but it's also good for children and that don't wear the makeup,
That's
that have acne problems,
and men who don't normally exfoliate.
It's great. It's great.
Wonderful.
And I keep this in the shower. I use it, in the shower. It's waterproof. It's a great product,
great.
and it pays for itself. It's just a dramatic thing. So it adds to these technologies that are available now that people, that if they don't know that they're available and they don't go to a doctor's office, they may not find that they can get these types of treatments.
Right, and these
really
are the
good.
ones from your office are very effective. We're not talking about watered-down spa things.
Well,
this is the real McCoy.
Right. I like our products. My dad and I helped develop these products many, many years ago. We've modified the formula over the years, and we've got what I consider to be tremendous products for patients' skin.
I definitely agree. I think we have another slide, so we will take another look at a picture.
Let's go to that.
And if you do have a phone call, 644-9840 is our number.
Yeah, this is just another patient that has these just general aging changes to the skin and things that look a little bit, not fresh and healthy looking. And we can dramatically turn it around with some in-office treatments and a lot of the home treatments. We're not talking about having the patient spend a lot of money in the office. We consider it to be a jump start. We try to get the patients, on the Jump Start program, and then the maintenance is done at home, and they do it on their own. Now, this is an example of a woman that had an intense pulse light treatment, IPL, again, a non-surgical treatment done by my staff and by myself as needed in the office, and it can just rejuvenate the skin. No surgery between these two patients, two pictures here. And you can just see a nice refreshing of the skin, a healthier look. Certainly she would benefit from a surgical procedure, but a lot of patients don't want the surgery. They're not quite ready for it. It doesn't seem to be in their cards at this point in their lifetime. So if we can sort of fend off the need for those surgical procedures, reduce the aging process a little bit, turn the clock back some, and then at some point down the road when gravity catches up with them, which is going to it eventually, then they can have the surgery to tighten things up.
It seems to me that the rule of thumb here is more come in sooner rather than later.
Oh, absolutely. Yeah. Because, if we can get the maintenance to get people on a good, healthy skincare regimen, and it's no different than brushing your teeth every day, eating healthy every day, doing a little exercise on a weekly basis, this is maintenance for your body. And maintenance for the skin is the same thing. So we use these skin products at home. You cleanse your skin every day. You put the moisturizing creams that exfoliate on. And I think that's this ongoing skincare regimen that's helpful for everybody's skin. And
I know you mentioned that there are people who do have cosmetic riders.
Well, there are some patients that do have coverage of these for skincare problems and acne treatments. So you might want to check with our office, call my staff, and they'll help you find out if something this would be covered by your insurance.
Even better. We have a phone call for you.
Good.
Hi, you're on with Dr. Sam Shatkin Jr. Hello.
Hello.
Hi, go ahead, please.
Yes, I was wondering because I'm a person that had lost a lot of weight, and from the weight loss, I developed like a sag in my neck, and it wrinkles a lot. And I was wondering if there's anything that he can do about that.
Right. Well, we have some relatively non-invasive surgical procedures for that. Sometimes we can do a treatment with liposuction, where we're basically taking a little bit of the fat that might remain and getting that skin and the muscle to stick together to bring that skin up so it's tighter. On other individuals that have a lot of loose skin, we just may need to do a little neck lift and some tightening, in which case the incisions are hidden pretty much behind the ears, so you don't see them that much. And then we have these machines and these products here that have been helpful to try to augment the results that we would get with any surgical procedure or non-surgical procedure.
So she should probably come in and get an evaluation.
Well, let her come in. If you do call the show here, we'll give you a free consultation, let you come in, and we'll be glad to see you.
That's great. Save and know the green. Love it. Dr. Sam Shatkin Jr., and you can see Dr. Sam Sr. and Todd, who is the cosmetic dentist here as well as an entire medical staff, and they're at 2500 Kensington Avenue in Amherst. They're the Aesthetic Associates. Give them a call. Give them a call today at 839-1700, 839-1700. They'll be so happy to work with you.